Hello everyone, and welcome to the future of medical image sharing. Today we're going to talk about improving data exchange on the cloud. My name is Janelle Anise, and I'll be making introductions first about our speakers and company. We'll be taking a look at what medical image sharing is and how it might benefit your practice and how we can measure its impact. We'll also look at what image sharing trends should be. We should be watching for.
The broadcast is now starting. All attendees are in listen-only mode.
Hello everyone, and welcome to the future of medical image sharing. Today's topic, we'll be looking at improving data exchange on the cloud. My name is Janelle Anise, and just quickly going through our agenda plan for today, I'll be making introductions of our two companies and speakers who will be joining us today. We'll take a look at what is medical image sharing and how it will benefit your practice. We'll look at ways we can measure its impact and what image sharing trends we should be watching for. And finally, at the end, we'll be answering some of your questions. If you may have noted, there is a question section on your panel. As a participant, you will be muted, but you're more than welcome to put your questions into that box, and we'll do everything we can to address as many questions as possible at the end of the presentation. If we didn't make it to your question, we'll be sure to answer it later as a follow-up item. So I'd be happy to get us started, and thank you for joining. Just a little bit about RadSight. RadSight was founded in 2005 as part of HealthHelp and became a separate company in the fall of 2011. We're a hybrid organization which is privately held. However, we have a governance structure which is very similar to a nonprofit accreditation organization. And that is managed by a board of volunteers, including an advisory board, investor board, standards committee, and accreditation committee. Our offices are located in Annapolis, Maryland, and Houston, Texas. I'm talking to you from Houston today. And RadSight's certifications of diagnostic imaging facilities cover over 24,000 imaging providers that are certified and over 60,000 individual imaging systems. We offer a seamless approach to quality benchmarking, credentialing, certification, accreditation, and outcome studies. We offer these services for provider offices, imaging centers, and hospitals, and a full range of imaging modalities, focusing on diagnostic imaging. Through our history, we've built one of the largest databases in the United States for imaging systems, collecting over 100 data points for each imaging system that we've reviewed. RadSight's mission is to promote quality standards and safety in medical imaging. We assess, certify, and audit imaging providers, working with those providers through ongoing relationships and peripheral services. We have a core belief in transparency across all imaging modalities, and we're most proud to have based our relationship and education-centered model. Also joining us today is DICOM Grid, founded in 2006 by a group of radiologists. They're based in Phoenix, Arizona, with a satellite hub in New York City, and DICOM Grid Brazil launched in 2013 to bring image exchange to Latin America. DICOM Grid offers cloud-based solutions to enable accessibility, management, exchange, vendor-neutral archive, and viewing. Solutions are based on industry standards such as DICOM, HL7, HTTPS, XDS, and XDS1. They are currently managing 1 billion images for clients worldwide, and were named the best medical information solution in 2013 and 2014 by the Software Information Industry Association. We're happy to be joined by two featured panelists, both from DICOM Grid, Mr. Morris Tanner, who is the CEO of DICOM Grid. He is an experienced software executive, having recently built and sold an industry-leading business process software company, OpenAir Incorporated, to Larry Ellison's on-demand software company, NetSuite. Previously, Tanner had worked in healthcare IT, partnering to form an early teleradiology venture. Morris has also worked as a federal prosecutor for the U.S. Department of Justice and as a corporate attorney with Watchell Lipton. Also, we're privileged to have Dr. Ricardo Curry, Dr. Curry serves as the Director of Cardiac Imaging at Baptist Hospital in Miami and Baptist Cardiac and Vascular Institute, as well as Radiology Chairman and CEO of Radiology Associates of South Florida and Vice Chairman of Radiology at Florida International University. Dr. Curry is currently expanding DICOM Grid's footprint in Latin America, so we're happy to have both of you. Once again, my name is Janelle Agnese. I'll be the moderator for today's presentation. I'm the Director of Operations for RadSite, and I've been part of RadSite since it was an idea back in 2005. I don't have a healthcare background previous to RadSite. My experience comes from working in mainly customer service-focused industries at Enron and Aeromexico Airlines. Love the healthcare industry, and I continue to learn something new every day. And I'm pleased to be here to take you through this interesting presentation. So today's goal, we'll take a closer look at how medical image sharing provides value to not only your practice, but the organizations you work with and the patients you care for. So what makes image sharing so difficult? Morris, can you tell us about that?
Yeah, thank you. It's really nice to be here today, and I think you've really hit on a pretty important topic. And I think all of us have experienced it in one way or another. You know, at its most basic level, after you've had your imaging studies done, there seems to be a lag time between when that study arrives where it needs to be. And I think all of us have felt the impact of that delay on care, whether you're trying to manage practice and make sure people are seeing the clinician they need to see at the right time and that clinician is properly armed with the information she needs. Or if you're trying to bring sort of the other end of the extreme, a trauma victim in, and sometimes you actually have to then start over, do imaging if you can't get it in time, or you are waiting to get valuable information. So now what you see is typically the way image transfer is done is by CD. And if you analogize that to something in our everyday experience, that would be as if the way you did online banking is you downloaded a CD and walked from branch to branch. People would think that would be ridiculous. And instead, they are very accustomed to an online system with very sensitive information, and that's where we're heading as well in healthcare. And kind of coming along with that, one of the nice things about online banking is you feel actually pretty good. You know exactly where your money is gone, and you can see accurate records of your account. Right now, what happens is kind of records seem to float through the mail, or you're wandering with them, and you really don't have a sense of when things have been delivered, when things have been sent, and that can lead to a lot of anxiety in addition to slowing down vital care. And finally, this puts a real cost on the system. The notion of having people processing and managing these physical media really can become just a drag on a practice and or something you kind of reluctantly have to impose on patients. So somebody who's in the middle of really sensitive care ends up getting charged an extra $45 or $50 just to cover the cost of being able to transfer an image from one place to another, and no one wants to impose that on somebody who's already managing quite a bit of difficult care decisions that are implicated by advanced imaging. So thanks for the opportunity to outline that.
Great, and I appreciate the great analogy. I know we're all concerned about quality and cost. So how can you make it easier?
You know, I think at the end of the day, what's really nice is that we have some models out there that take into account what probably everybody worries about, which is let's make sure it's extremely safe, let's make sure that it is a cost-effective system, and let's make sure it ties together our existing systems. And that's really what DICOM Grid is all about, is we're taking that electronic network, We have some IP around making sure that it is protective of patient health information, and have some other technology which makes sure it connects to existing systems. And finally, built into the system are all the types of tracking and audit controls that healthcare at any sophisticated level demands today. And we do all of that by eliminating the CDs and physical media that are such a drag on the system.
Great. So I understand that there are a couple of methods for sharing medical images. Can you tell us a little bit more about that?
Sure. The first way, and these are really the two systems that I think most of us experience. If I am in a situation where I've just received an imaging study, I may well have a CD, and I may well want to send that information either to get a second opinion or some additional insight, or following the continuity of care plan that someone has provided or suggested to me. So we let you use your PC or Mac and let you just upload a CD right from that system. You can do that as a physician, you can do it as a patient, anybody who has a CD. And it's really a very simple system, no software required, and very easy to use. The second way is something that a lot of practices are interested in, which is an automated system which lets you, with the equivalent of an online meeting software, piece of software, that's how big it is, lets you go ahead and set up a automated routing system between different practices and yourself, and or between yourself and hospitals, however you want to do it, or imaging centers, and eliminates the need to touch CDs altogether. And this becomes very compelling for people who are trying to build referral relationships and or relationships with healthcare systems.
Great. So the most common being the method number one. Can you give us a little bit more of an example of how that works?
Sure. You know, I think what you see is in our system is something this simple. You literally have a way of simply sharing studies via email. And none of the PHI goes that way, but all you need is an internet connection, and you are good to go, and you can go ahead and send an email to someone who will get a login notice, and they'll be able to access just that information that you sent to them. And that's how a lot of people do this, and quite frankly, we have some very compelling stories where mothers who are trying to take care of kids and trying to get some vital information have used this. And as someone who's dealt with some of that with my own family, it's a wonderful, wonderful way to go.
Great. So can you think of a story of how image sharing has made a substantial impact on one of your organizations?
I can. What's so interesting is I think a lot of us, myself included, have struggled with the idea of trying to get imaging to the specialist who needs it. And one of the ways that our company has expanded is that we were actually at a global leading institution talking to a practitioner, because as a company we try to stay very close to the practitioner community, explaining the use cases, explaining the challenges. And the practitioner at lunch said, you know, it's funny that you say this, because I have a case right now where I am contemplating an interventional procedure. I've had this person transferred in, and what I'd like to do is get the imaging more quickly, but quite frankly, I'm waiting for them to ship the CD, and I have the initial take on it, but I'd really love to see the imaging a lot quicker. And the physician says, we say, great, let's stop having lunch, let's go back to your office. All you require is the computer you have in your office. Let's go ahead and take a look. Quite frankly, now our system runs on the iPad. If we had an iPad with us, we could have done it right from lunch, but we went back to the office. We log into the computer. We contact the healthcare system that transferred the patient. They uploaded the patient's CD, and at that point, the whole room changed. The physician looked at it and said, oh my golly, you know, this individual needs to be in the ICU now. We really need to change the treatment path. And as you can imagine, that healthcare system soon thereafter became a customer of ours. But it illustrated how impactful the timely delivery of imaging can be for for really changing the course of a patient's care. And after that, I asked the physician, what would have happened? And the physician said, a patient might have lost their legs. And quite frankly, it probably never would have been viewed as anything but sort of the usual friction in the healthcare system today, where sometimes delays happen because of where technology sits, and there wouldn't have been anything we could have done. And thank goodness we have some different alternatives available to us.
Wow. I'm sure there are many other stories like that. It's amazing. So I guess I'll pose this question to our guests. If you were to guess how much we are spending as a healthcare system on duplicate and unnecessary image exams, would you think it's over $1 million, maybe even over 500 million, over $1 billion, even up into 20 billion and up? Morris, what is the answer?
Well, remarkably enough, we're really looking at that very high end of that category, the 20 to 40 billion dollar range, and that's something that I think takes almost everyone aback when they start to think about that, and that doesn't even take into account, the sort of human cost of what I described. Really remarkable.
Unbelievable. So tell us a little bit more about image sharing and some of the key ways that this occurs.
Well, I think you really have three pillars. And the first is to and from patients. So that means that a patient wants to, we've all had this experience. You're waiting in clinic. Somebody comes in and they say, oh, I had a MR done, and you notice there is, of course, in the chart. Yep, they did. And then you look for it and it's not there. And you never end up seeing the patient because there's no point in meeting with the patient, and they have to come back, or in a trauma case, you redo the imaging. That's just very, very difficult. So this is a quick way and a wonderful way to make sure that patients have timely information available to their physicians. Second of all, just within your own organization, it can be extremely difficult to do a good job interacting with your colleagues. And this is more and more important as healthcare systems cease to be individual hospitals, but really are looking to do cross-fertilization and referral management within their own systems. So if you have access to a really wonderful neuroradiologist, you want to make sure you can access that person, even if it is not exactly in your hospital. It might be in a sister institution that's part of the healthcare system. And then finally, if you have unaffiliated organizations that are outside of your network, you may well want to be able to access their expertise, or increasingly major and leading medical centers want people outside their system to know that they can access their leaders. So we have very successful stories of second opinion programs and the notion that you can get top-end care to underserved areas, and that too is very inspirational for everybody who is engaged in it today.
Fantastic. Well, Dr. Curry, I'd like to have you weigh in a little bit here. When it comes to measuring results, of course you'll need to address the question, how do we define success? Can you talk about that a little bit from a practitioner's point of view?
Sure. No, it's my pleasure to be here as well. And I think I can share my experience. And even maybe if you could go back one slide, I can share the experience that we implemented in our practice by using image sharing first with our main need was with referring physicians, so that referring physicians would have access to images not only within the healthcare system, but also outside in their offices, or really anytime, anywhere, if they would be at home or in their offices that wouldn't be connected with the hospital or the outpatient center. And that was a major plus for the referring physician, so that instead of, and that goes in the measure of success, the standard way would be they would prescribe an imaging study to a patient. The patient would go to the facility, do the MRI or the CT or the X-ray, and then probably would have a visit scheduled 1 or 2 weeks after. And then the patient would come back during that visit and bring the CD so that and the report, and then the referring physician would act at that point in 2 weeks or 3 weeks after he ordered that study. And now what we are seeing is that with image sharing and by using DICOM Grid, the referring physicians, you can set up automatic rules that their patients, they have, as soon as their result is available with a final report from the radiologist, they have access either through a link, through an email, or they can log in and check their individual patients. So they have access if they need in the same day. And if there is an important finding, they can act upon and contact the patient as opposed to wait 2 weeks or 3 weeks for the patient to come back to his office and bring a CD. And when we are looking in this new healthcare and this new environment for coordination of care, this will be critical. You want to coordinate care from the outpatient setting to the hospital, from the hospital to the outpatient setting. And by having imaging available at a point of care, that it's critical so that we are not doing duplicate diagnostic tests, that we are not exposing more to radiation dose. So that is the second main point. I think the first point is you decrease the time of care to deliver your treatment, and that it's critical. And the referring physicians, they just it's really a major engagement since we offer this to our referring physicians, that they want to use those facilities because they know that they will get timely results and look at the images if they need to, not only at the reports. Then I think that the third main point is that you are facilitating and improving the lines of communication and between all care providers, including the patient. So we are seeing more and more patient engagement. So you can set up with this system imaging portals. I think our first approach was tailored to the referring physicians, and that worked great. Then we tailor to patients so that they are able to track, to have their own account in the cloud, that they can have all their imaging studies in one place as opposed to be carrying a lot of CDs and old studies. So that improved lines of communication, not only between the providers, but also you empower the patient. And finally, it's a reduction in image exchange costs. With the imaging portal, you have a significant decrease in costs regarding the physical media, the CDs, the personal, the printed material that we might have in color code, and it's all available and secure and HIPAA compliant. So that was basically the ways that we would measure the success. Is really expanding our referral base.
Fantastic. Well, Dr. Curry, if you're like most healthcare professionals, growing your referral base can be a daunting task. We get that. It's hard work. But in an increasingly crowded industry, attracting new opportunities is critical to stay alive. Would you like to share some of your thoughts on these 4 key points?
Sure, absolutely. And I think that is like driving referrals. So expanding from what I was saying, you are getting basically the image data to the referring physicians, so they just need access to the internet and they can look at images and the reports with an iPad or from their office and from home. So that's a major point, so that they are engaged and supportive of your results. It's very convenient for them. Also, there is a image share analytics in the software that you can track the origins of imaging and look for new opportunities. So you can target certain physician groups, if it's a cardiology group or orthopedic group or oncology, so you can better understanding your source of referrals. So that is very helpful for us to expand the footprint of an imaging center or a hospital-based imaging provider. And I think it's a way, it's very competitive, it's a way to differentiate ourselves so that patients would like to come back because they want to have their studies in a single place and know, they understand that their physicians will have immediate access to the imaging and the report, and the referring physician as well. So you're engaging all the key stakeholders here in the imaging and hopefully decreasing the time and improving patient care by streamlined communications with patients.
Fantastic. Well, I'm sure those of you who are listening have some questions related to image sharing, and I know both of our panelists can help us out with some of these common questions. Morris, first can you talk a little bit about security, integration, and scalability?
Oh, absolutely. I think each one is something you've got to look very closely at. The first one is obviously a must-have, whether you're just thinking about HIPAA compliance or just thinking about the notion that we want our health care to be secure in its most basic terms. You need a system that has true health care level security controls. And as I say, we've spent a lot of time developing patents around that because it is slightly different. We've done things to secure the separation of patient data from imaging data and to do other things that make sure patients can and the facilities that are engaged in providing the care can rest easy at night. Integration is another key point. I don't know of a major healthcare system that doesn't have a PACS and a RIS today. And the notion that you would not want to capitalize and make the most of your existing investments, I think, is tough to swallow in today's cost-conscious environment. So what we do is sit on top of those systems and enable you to continue business as usual, but augment your capabilities. And I'm sure Dr. Curry can chat a little bit about that. They have wonderful systems and a wonderful information technology team. And I think that partnership has been something that is illustrative of how both large and small facilities can work together. And just on the side of scalability, one of the things that's important is you are now going to have the capability to bring more information into the system, and you need a system that can handle that and can manage it. And with 1 billion images under management, we're very, very good at that. And what we like to hear from practitioners is the good problem, which is they're getting, for example, more surgical referrals than they ever had. And that kind of volume is a good problem for a growing and vibrant medical practice to have. So certainly, Dr. Curry, I'd love to reference your expertise on these points because I know that we have worked together at your facility, and that's been an extremely positive experience.
Yes, I can tell. I think in the beginning, the security and the patient privacy was a concern, and I think that was addressed by having the technology that you explained, like the split merge technology that you first it's HIPAA compliant, cloud-based, and then you are separating the patient and the imaging data when you are transmitting the images, and then you do the merge again when you are protected back into the data center. And regarding like the transition, I think it was very interesting. In the beginning, you always have, well, like some referring physicians that I don't know if that will facilitate my life or not, but after they start using the system and seeing the capabilities of the system, that was a no-brainer. That was like word of mouth that really referring physicians coming and asking other referring physicians coming and asking that they would like to have access to the system so that they can see the images of their patients. And we saw, I think, in another front, we saw an increase in second opinions as well. We have a referral base from international patients, mainly coming from the Caribbean and Latin America. Now it's a lot more convenient for sites to send their patient information and their imaging studies and provide at least a preliminary second opinion report, and then plan their transfer and like their surgical procedure or interventional procedure if you wish. Because before, you have patients that will have to come into our facilities and do an evaluation, sometimes repeat the imaging studies before doing an intervention. So now you are facilitating that and also decreasing the costs to the providers in that end. So that is one area of big expansion now. I think we worked with the referring physicians. We are improving the imaging portal and the patient engagement, and now looking at areas of expanding our footprint. And one last point that might be useful is also we do have PACS and we do have RIS, but that sits on top. And that, for the referring physicians, is a lot easier instead of logging into a VPN and trying to get inside our PACS to just go through the cloud and using the image sharing capabilities and get to what they want. And that can be also used as a backup for disaster recovery. So I think that's the interesting part of that as well.
Well, thank you, both of you, for addressing some of these key concerns. So what is on the horizon for image sharing on the cloud? There are some interesting trends that we need to be watching, and we'll take a look at today. Some of those include second opinion programs, patient control, hybrid models, and health information exchange. Morris, can you tell us a little bit more about the second opinion programs?
Yeah, absolutely. I think what's really exciting about second opinion programs is everybody in healthcare is about the notion that the patient should receive the absolute best care that they can get. And all of us want to do the best for a patient. And what's exciting about second opinion programs is now, with this image sharing capability, it makes it easy for a practice or a department or a facility to set up the ability to receive complex diagnostic imaging easily and render a true second opinion. So I'm not just talking about the idea of reinterpreting or doing overreads for radiology, although that could be important. But more fundamentally now, you're in the position of being able to provide people the insight and advice that you would want to provide them. So today, I think the general standard is that you would call somebody on the phone, or you would send somebody an email and say, hey, could I talk to you about this case that I have? And almost the first thing any outside expert will look at is, could I see the imaging? And what this makes possible is the ability to have a true collaborative relationship around complex conditions, so that you can really provide care to anybody, anywhere.
Fantastic. So can you tell us a little bit about the patient control and the poll that was recently done?
Absolutely. What's been interesting is that we spent some time doing a little bit of primary research because we were curious about how people would feel about having a little bit more control over their care, and trying to understand what were the impediments to people really being able to control their own healthcare destiny. Patient portals are a key part of meaningful use, and they're a key part of the notion that people should be in more control of their healthcare. And the poll was really interesting. People, not surprisingly, when they're in a complex healthcare treatment course, struggle getting images from one location to the next. And an enormous proportion, over 90%, showed interest in being able to access this type of information. And maybe we shouldn't have been surprised, but it was still interesting to see the data as starkly laid out as it was. We had a couple of hundred participants participate, and really wonderful and interesting data.
Excellent. You can see here on the screen that a large number of people had an interest. So tell us a little bit more about what patients are actually saying.
Well, some of the quotes are here, which is nice, but I think the real point is that people in the real world are reflecting what the policymakers are talking about. How do you take care of a seriously ill person? Well, any specialist will tell you, I really need to see some of the imaging. And that's what people are experiencing, is how do I get them that? I know they need it, and I can't help them. I can't look at it and tell them what I think. They need to see it. Or another issue, when somebody comes in, they know it's not a good idea to repeat imaging. It's an unnecessary cost, but at a very human level, you do not want to be exposed to radiation more than you need to be. Nobody wants to have a medical procedure more than once. And what the frustration people experience is, I know I had this done, it's not easily available, I don't want to have to do it again. And then also, people understand that the continuity of care today is not just at the hospital. Some of the most important interactions you have are with a multiplicity of doctors in different locations, and you want it all to tie together in a nice way. And this is something that lets people have a continuity of care that makes everything more efficient and, by the way, reduces errors. Because when I meet a new physician, how many times have we been in the situation where we're worried something isn't clear from our chart or something isn't clear from our own explanation? Wouldn't it be nice to have everything available to everybody? And that's what people reflected in their very extensive comments on these surveys.
Great, wonderful feedback. So health information exchanges, we hear a lot about it, but I understand that less than 2% support medical images. Can you talk about that a little bit more?
Absolutely. Obviously, our company has been growing quickly. We've really appreciated the partnership with RadSite, and then reflective of how important this is for cost and quality control. And I think that's the impetus behind HIEs. Right now, they are still in the early stages of providing the kind of benefits of the healthcare system that people foresee for them. But one of the things that's happening is right now we're working with HIEs in Massachusetts, Texas, other states as well, that are really the path breakers in providing this kind of capability, so that the benefits that people are, quite frankly, reflecting in our survey are being able to be brought to them by these kinds of HIEs that are initially very driven by public policy concerns, but I think are going to take root in the healthcare landscape all on their own.
Fantastic. Now, for some, the notion of a hybrid model may be a little bit confusing. Maybe you can help us understand that a little bit better.
Yeah, well, no discussion of software is complete without at least one sort of technology moment, and this really is that technology moment. I think one of the things that we've done an excellent job of is accommodating the technology to the day-to-day experience. And what I think we all recognize is that the on-premise system works fine if you happen to be right next to the modality. I think anybody who uses today's PACS systems within the hospital knows you have the image captured, and then you're able to access it, and it all works very nicely. You're on a high-speed connection inside the hospital. And then we also recognize that if you're outside the hospital, the cloud system is absolutely essential for all the reasons we talked about today. And so one of the things that we've started to do is actually bring those systems together. So there are institutions where They either want to expand their kind of on-premise capability without necessarily expanding the existing PACS system, or they need to expand into a new area. And they want to and at the same time have that cloud-based capability. And what we do is simply marry the two together. We call it our hybrid model. It's a more and more popular way of handling the needs of large data and cloud-based access. So very exciting for people who think that they would like to use this as a more all-in-one system as opposed to something for the use cases of sharing and transfer.
Excellent. Well, let's talk just for a moment about accreditation and image sharing, and this is really where RadSite and DICOM Grid come together as one. As most of you on the call know, accreditation is one of the requirements for Medicare under the MIPA bill, as well as by many private payers and health networks who are looking for a form of accreditation or a certification. RadSite is one of the authorized bodies to accredit providers under CMS for advanced diagnostic imaging. Part of that process involves a review of imaging studies. And through the use of DICOM Grid, those imaging studies can be supplied to RadSite, the accreditor, using such simple methods. In fact, earlier in the presentation we saw method 1, which was the ad hoc method of sharing images. Basically, when your application is ready for review with RadSite, we provide a special URL in order for you to supply those images to us. This really facilitates an accreditation process, which is just one of the many reasons why images might be shared. It avoids the need to burn CDs, mail them, and have concerns about that PHI being circulated in the mail. Instead, they're seamlessly transferred to RadSite, where your review and determination can be made in short order. I know that with the requirement for accreditation, it's important to have that decision in place to avoid any interruption in claims, and this is where we make use of this technology to make an accreditation process easier. It can definitely ease the burden of this accreditation process, which can be daunting, but the ability to provide those images in a quick and easy way is just part of the process that we are very pleased to provide our applicants. At this point in time, I'm excited to see what questions have come across, and I do have a few that we've received already. And if you do have a question that you have not provided us, feel free to type the question in that section, and we'll get to as many of them as we can today. So one of the questions I have, Morris, I think this is best addressed by you. They're asking, what is the easiest way for a provider to begin transitioning from a manual to an automated?
Well, as the Nike commercial says, I think you just do it, because what's going to happen is you're going to be able to easily run the systems in parallel. What we've seen right now through programs with the RSNA, the Radiological Society of North America, where institutions have piloted this kind of system, they provide people both options. And so you may not initially see everybody giving up on their CDs, but what you're able to do immediately is start either eliminating some of the CD traffic and or using our system make sure that the clinicians have instant access to those CDs, which in and of itself is a big, big step forward. So you just go ahead and upload those CDs and the clinician can access them immediately, and that really is a nice path forward. So we provide that kind of transition service where people are still showing up with CDs, no problem. You just upload them right there on site and gain at least much of the benefit of having instant access to healthcare information. You won't have to send that person home. One of the things we also do, which is also part of our technology development, is we handle so many different types of CD formats that you're not going to have the problems of compatibility, which sometimes happens today, where you try to stick a CD into one vendor's system and it rejects it if it's from another vendor's system, and that's just gone away with our system. So that's that's a useful benefit as well.
Great. Thanks for answering that question. And I have another one. This sounds like a really good question as well. They're asking, how do colleagues collaborate? You talked about collaboration and the benefits of that, but do all the providers or doctors need to be DICOM GRID clients in order to collaborate?
Absolutely not. I think absolutely not. And I know Dr. Curry could probably talk about this because although he's a user of our system, I am fairly confident that he works with a lot of people who are not, and you know, I think he could give you some perspective on that. The core philosophy of our company is interoperability, but maybe a practitioner's perspective would be helpful here.
Sure. Yeah. Basically, if you are, let's say, a radiologist and you want to share a case with the referring physician, or if you are a primary care physician and you want to share a case with a specialist, basically you can, it's just a click in the system that you send an email with a link, and the other person, even if the person is not credentialed in that network, he can click the link. It's an easy process to sign in, and we'll have access to that specific study. So if you want to discuss a case in real time, you could just email that link to the other physician, and the other physician in the other part of town or in the hospital and the other in the outpatient center. They can easily discuss the case and look at the images. And it's really the imaging center or the hospital that might be the provider contracting with the DICOM GRID.
Thank you. That really helps. Here's another question. We did talk about how interested patients are in these abilities, but this person is asking how you typically get patients to engage if they're fearful of security issues.
Well, I could certainly start with that one. I think one of the core trends today is more and more online access for patient records. So the good news is you have the wind at your back. You have the government talking about the importance of this. You have a baseline familiarity with sharing sensitive information on the web. Most of us are used to putting a credit card in the web, and for many of us, our financial information is as sensitive, or in some cases more sensitive than our healthcare information is. We're used to those kinds of security protocols, and when people hear that, they start to get a little bit more comfortable when they realize that when they pay the hospital bill, you are able to use the credit card integration system safely, and this system works safely as well. I think sometimes people also wonder when you're emailing links around, you know, are you worried about security on that front as well? And what's nice is we have a credentialing system, so the only data you get access to is your own data. And it's certainly true that if somebody else logs in as you, there's a chance they could look at your information, but that's exactly the same type of risk that you take whenever you have an online system of that's a password, username and password driven system. So most people are pretty careful with it and are used to taking care of it in that way. So the email link without that vital username and password won't do you any good in the same way that any of the other systems require that as well.
Good. So good common sense with managing a password, as always. I have another question that came across. Can a patient direct the image to a physician that they would like to have review their image? I mean, we're talking outside of a referral.
I'm happy to start here, but Dr. Curry certainly may have some insight into this as well. I mean, the simple answer to that is they can. because this has the capability of sending these links to another physician, you can send an email. The physician then can set up their own account effectively. There's no charge, and they're able to view the information that you sent them in that secure window that's behind the 3-tiered authentication system. So that's really another benefit of patients controlling their healthcare information, is that you can show it to people who you want to have see it.
Great. So it really does put the control back with the patient. That's fantastic. I don't see any other guest questions at the moment, but since we've been talking about so many topics, is there anything else that you can think of that maybe would be on some of our guests' mind that you want to address?
Yeah, I would have some final thoughts. I think this is definitely we started with this like 2-3 years ago, and we just are expanding the applications that we used. As I mentioned before, we started with referring physicians, and then a second step with patients, and then with for the radiology group, like for facilitating remote reading or teleradiology, and then we are now seeing this trend of second opinions. Regarding the patient embracing this, we see exponential. Actually, they are now demanding this. They don't want more to have a CD or wait 2 weeks to go back to their referring physician to find out about their results. They want that their referring physician have access to the imaging data in a timely fashion, and if there is any problem, for the referring physician to call them. So the referring physicians have embraced this. I think having this capability of image at anywhere, anytime, it's critical in the healthcare that we are living. So I think this is a pathway that it's extremely beneficial. And if you look at healthcare reform and Obamacare, that is one way that you are improving quality and decreasing costs, and those are the ways that we want to add value. So those are my final remarks.
Excellent. Thank you so much for sharing that, and for both of you for joining us. I think the possibilities are endless. I'm excited that through this technology and DICOM GridRAD site is able to offer an accreditation workflow that is easy and convenient for the provider applying and allows us to price our program very competitively. So we're excited about things to come. Just in closing, I will let you know that we will be following up with all of you with a closing package. If you have sent a question that we have not been able to address during our time here live, please bear with us and we will answer your questions. We're more than happy to do that. We've placed our contact information on the screen, but it will also come in the closing package to all of you who are registered. And we really appreciate you joining us this morning, and thank you so much for your attention.
Thank you.
Thank you.